Over 80% of Americans will experience back pain at one point in their lives, and yet there's no solution in sight that is reliable when it comes to back pain. The reason this should be concerning is because at my clinic here in Scottsdale, Arizona, when my team sees someone with back pain, we're seeing someone with 5, 10, 15, and 20 years getting over back pain that they've had for a long time, even if they've tried stretching, massage, foam rolling, or chiropractic without any results. And the way that we do that is simple. We work by reprogramming the brain using specific movements. And today we're going to share with you the exact first 4 exercises that we use in my clinic to help people start getting back to an active, pain-free life and living a life without back pain, where they don't have to fear that they are going to suffer the consequences of being active. So if that's you, make sure you tune in for these 4 videos. Try them out on your own. Disclaimer, make sure you don't do anything that you feel uncomfortable with or that you feel is going to hurt when you're doing it. So you're gonna have one knee on a ledge, preferably about only 1 to 2 inches in height. Plant your hands firmly on the floor. Okay, now from here, you're going to just lift the down leg and set it back down. Okay, you're not keeping your toes on the ground of this leg. You're just picking straight up the entire leg and setting it back down in between each repetition. You're not shifting your weight to the side to pick that leg up either, okay? Everything up here should stay non-moving, and you set it back down, and you're just picking it up till your hips are level. So it's very important that you don't blow past neutral here, and that you're not hiking your hip to the side, not bringing your pelvis any closer to your ribs. So pay attention to those 2 things, okay? You want your hips not just stacked vertically, you actually want to be 10 to 15 degrees past vertical. Now you can keep your bottom knee slightly bent. You don't want to have it way up here because that's going to get in your way of actually getting past vertical a little bit. Okay, so just have it bent right there, support your head, bring your knees slightly past vertical, or your hips rather, and you're picking this leg up and backwards as if you're dragging it up a wall behind you. Not here, forwards. There should be no flexion angle in your hip. If you look down, you should not be able to see your toes. Okay? You keep your foot pointed forward. Don't let it go up to the sky like that. And don't let your hips come back here. Okay? You're going to bend your hips up almost to 90 degrees. So it's going to be at about 80 degrees here. Make sure you're protecting your head. Okay? Now, instead of just thinking about lifting your leg up and down, which a lot of people do with their clams, I want you to think about taking your thigh and literally rolling it like that. Okay, so as you come up, you're going to be rolling your thigh away from you. And what this is going to do is it's going to bring the force right back here underneath that hip bone that you feel to the side there. This is, again, very specific to those muscles that we're trying to strengthen to get the hamstrings, hip flexors, piriformis, all those other larger movers to stop overcompensating for, to give yourself some more hip stability. All you're going to need is a firm surface and a towel or pillowcase folded up just like that. That pillowcase is going to go right in the small of your back. Okay, now you'll notice when you're there, if your legs are straight out, you should be able to pull that pillowcase from side to side. Now, we're not going to let that happen. We're going to tighten our core by drawing in and then making like a clear your breath kind of contraction with your abdomen here. You'll be able to feel your abdominals contract with that. Now you do that and push down with your low back into the mat or table or wherever you're lying, and you can't move that towel now, okay? Now that's the contact with the table that you want to maintain while doing this exercise. Level 1, okay, is just marching legs one at a time. Notice that you should still be able to breathe and you can't pull this towel out, right? You're still maintaining that contact. Once you get to where you can do 15 to 20 of these comfortably, you go to level 2. Level 2, instead of marching by bringing your legs up, you're still doing a march, but you're kicking your legs out one at a time. If it's hard to do this while pulling on the towel yourself, just get somebody else to help you test to see where your strength is at. Okay, if you can complete level 2 successfully, move on to level 3. The way you do level 3 is bring one leg up, then bring the other leg up, then down and down. So it's up, down, down. Okay, you can do 10 on one side and then 10 leading with the other leg. Okay, once you are able to pass level 3, you're going to bring both legs up for level 4. You keep that contraction as you extend one leg out as close to the ground as you can. Bring the other one back, bring it back in and do the other one. Okay, once you get to 15 or 20 there, should be pretty strong by that point. But if you want to take it a step further, we're going to go to level 5. Level 5 is both legs up. Maintain that contact as you slowly bring both legs out. See if you can hold that while keeping the towel from moving, and then come back. Okay? If you can get to 15 to 20 reps of that without someone being able to pull that towel and without losing that back contact, your core is pretty strong. So I hope those 4 exercises are already helping you start to feel a little bit better. Go ahead and stand up, wiggle around, bend over to touch your toes, see if you do feel any sort of relief. Like I said, these exercises are just starter exercises. They're the beginner exercises, and they're designed to basically start reprogramming the brain to use the right muscles in the right way. Go ahead and comment and let us know how these exercises have helped you. And go ahead and like, comment, and subscribe to this channel to get more content like that. We're going to be putting out a lot of content, whether it's back pain, knee pain, hip pain. Our clinic specializes in helping people who have struggled to find solutions in the regular medical system to actually regain active lifestyles and live life today.